Hey, what's up, everybody? So, today we're going to talk about alternative and regenerative treatments to manage your pain, specifically to the musculo-skeletal system. I'm Risa Morimoto, your host. I'm an integrative nutrition health coach, and you're watching Modern Aging, where we chat about innovative and holistic ways to elevate our health and well being as we age. If you haven't subscribed to the channel, I'd love for you to do so. All you have to do is click on that little red button below with that little bell next to it to be sure to be notified whenever a new episode is uploaded. And you can also check out our new website and with all our latest programs, and that's at thisismodernaging.com. So my guest today is Dr. Larisa Likver. She's a physiatrist with a subspecialty in pain management. She teaches us of how to understand the root causes of pain, the very importance of having inflammation, and the effectiveness of Prolotherapy and Ozone Therapy. So check it out. Dr. Likver, thank you so much for joining me today.
Thank you for having me.
No, I am super excited. This is an important topic, but I want to start with actual basics. You are a physiatrist,
Yes.
correct? Okay.
Yes.
I think a lot of people don't even know what that is. So maybe you can kind of explain to us what it is that you do. I know you specialize in pain management and also regenerative treatments, correct?
Yes. Physiatrists, a lot of people, unfortunately, have no idea about the existence of this field. And if somebody heard the word, they do not have a clear understanding what it is. Physiatrist is a medical doctor who has to go through medical school, through the residency program, who specialize in non-surgical treatment of musculo-skeletal conditions. And physiatry as a medical subspecialty was registered in the United States in 1947 after World War II, when wounded soldiers start to come back, and after injury in war, they lost some function. And physiatrists were helping them to utilize those functions which were preserved to compensate those which were lost. And this is kind of how our field officially was born. And we still need this up to date because things happen in our life, injury, surgery, trauma, different things. And our body, incredible, unbelievable self-healing machine with almost unlimited compensatory ability. But sometimes people do need special guidance and training and other methods to help them to utilize their body to the full capacity.
Your typical patient, what are some of the ailments that they have? What are you treating them for the most, like in general terms?
Well, again, I specialize in musculoskeletal condition, back pain, knee pain, shoulder pain. The range of patients goes from like teenager to 90 plus, and everybody in between. So it might be a sport injury in gym, uh, uh, age-related changes in our joints, um, post-surgical discomfort in the area which was operated or remote area from the surgery, but body start to compensate to the surgery, and other areas might become dysfunctioning or discomforting. I mean, it's absolutely very wide varieties of patients who can come and get help from physiatrists. But again, the thing is like musculoskeletal condition, which is like, musculoskeletal, the name stays for itself. The muscle is muscles and tendons and the skeleton, it's our bones. And everything would connect them together, including nerves
So there's physical therapists, and then there's orthopedic surgeons, and then physiatrists land somewhat in the middle, and your medical doctors. So when would someone see you? I think, because people know about PTs, people know about orthopedic surgeons, right? At what point, if they don't want to go for surgery, should they come and see you? I know you also use a very integrative approach. Is that right?
Yes, absolutely. Back in Soviet Union, I was internal medicine doctor. And here in US, I am physiatrist, pain management. And my experience and my internal medicine background from my previous life really helps me to look at my patient as a whole, as the whole unit, not just the right shoulder, left knee. And this is what healing takes. The whole body has to participate in the healing process. And you asked very, very important and very sensitive question, because most of the people have no idea about the existence of the field. They do not know about physiatry, and even if they hear about it, a lot of time they're mixing up physiatrist with physical therapist. Physical therapist, it's a specialist who went through physical therapy school, and they're the one who actually physically provide the physical therapy. They do like the therapeutic ultrasound, electrical stimulation. They stay with the patient and train them how to do therapeutic exercise properly. Physiatrists, again, we're medical doctors. We kind of one who refer to physical therapy. Other doctors also can refer to physical therapy, but kind of for us, it's easier to do because we're looking at the musculo-skeletal system, and we know what kind of physical therapy would be better. And we a lot of time work closely with physical therapists, but we're not physical therapists. In orthopedic doctors, it's medical doctors who are surgeons who are trained to help with the musculoskeletal condition with the surgery if surgery is necessary. So physiatrists kind of stay in between. So when the time to see the physiatrist, actually, when something happening with our body has a tremendous ability to heal itself. And most of the time, like healing will occur if everything goes in the right direction. Like in 3 months, most of the time, problem should go away. It means the healing went through and body can function again in the normal way. If in 3 months after whatever happened to the person, pain is still there, and again, with the from 0 to 3, like up to 3 months, we call it acute pain, which is normal body reaction. It's an acute pain. It's a protective mechanism for the body. We usually guard painful area and we rest it and we give body chance and time to heal it. And from 3 to 6 months, we call it sub-acute pain, when kind of the healing should be kind of finishing up and pain slowly should start go away. But if pain lasts more than 6 months, it's a chronic pain, and chronic pain is always pathological pain, where we were not created to have a chronic pain. To live with pain is wrong, and it's not the way we supposed to live, and it's not the way how we were created and meant to have our life. So the time to see the physiatrist, actually, it might be right away from the injury or whatever happened, first symptoms appear, or if person prefer to go to the chiropractic care, physical therapy, that's a great modalities. But again and again, if this condition were not resolved in 3 months, I would recommend to start to see the physiatrist and get more depth in the patient condition and see maybe other approaches should be incorporated into the healing process.
Pain management, pain in general is something that people have a very low tolerance for, right? They want the pain to go away. If you have acute pain, you want the pain to go away.
No,
And
absolutely. I mean,
it's
yes.
why I think we have, partially responsible for the opioid crisis, right? Is, we want to take a pill to make the pain go away, and if it's strong enough, then we'll do it. But what other ways, what do how should we rethink pain management, and how can we heal ourselves? What are alternative ways that we can heal ourselves other than, taking a pill?
No, yeah, I mean, there's nothing wrong to control severe bad pain. And of course, if pain is really bad, person has to see doctor right away. It should be physiatrist, most probably physiatrist. So they usually start with internal medicine doctors, and actually internal medicine doctors has to kind of guide their patients which specialty they have to see if it's beyond their capability of their area of expertise. And it's absolutely, it's a good time to see physiatrists, who most of the physiatrists specializing have good knowledge, solid knowledge in pain management. And again, nothing wrong to control bad severe pain. But as soon as we get the bad pain under control, we have to do our best to to find the root cause of the problem and treat the root cause of the problem. But as a society, we're really spoiled, and we kind of like psychologically have a tendency just to looking for the quick fix. A patient come in the office and says, "Doctor, fix me." Well, I mean, the healing process is a process. It's not the fix, the like immediate fix of the situation. And we're always in a run. And we're looking for the quick solution. And pain medications taken in a lengthy period of time, we're just masking the problem. Because pain, again, it's a messenger. It's a messenger with the pain. Pain is a way of our body communicates with our conscious. And when we just killing the pain without looking why we have it and without helping body to heal, we kind of like killing the messenger. And again, pain is protective mechanism. And when we do feel pain, we do not overuse the compromised area. When we do not feel the pain due to pain medications, we're acting like nothing happened, and we're running, we're jumping, we're playing, we're lifting, we're turning, and we're provide like too much demand on the area which is compromised already. But we don't feel it because we took pain medications or had a cortisone shot. And thus we facilitate the degeneration of this compromised area. And
so what can we do then? What do you recommend that we do?
So because our body has, again, almost unlimited ability to heal itself, and our self-healing mechanism, self-repairing mechanism kicks in maybe in an hour and two since we're born, and it's always there. It's like a computer program. So there are like varieties of so-called regenerative treatments, which helps our body to heal itself. So it helps body to trigger self-regenerative process. Sometimes this process, I mean, they're genetically programmed. And when we have an injury, we usually have inflammation. We have pain, swelling, hot area. And what it is, it's all symptoms of inflammation, body trying to create inflammation because inflammation is the first stage of healing. Without inflammation, other stages of healing will not follow. Inflammation will activate immune system, and inflammation will bring increased blood supply to the area. Blood will bring oxygen, cells which are builders, nutrients, and all will provide all necessary ingredients for the healing process. But when we have injury, when we have pain and swelling, what do? We take Advil, Aleve, we take non-steroidal anti-inflammatory medication, so we stop the inflammation. If pain is too much, we have cortisone shot, which is even stronger anti-inflammatory medication. So we're stopping our body, we're stopping attempt of our body to heal itself. And this problem from acute become chronic. And chronic problem very difficult for body to heal, to treat. So when we use so-called regenerative treatments, we kind of like recreating good controlled inflammation, which we needed. And inflammation, like I said, it's the first stage of healing. And after we recreate the inflammation, good.
How do you do that? What do you mean recreate the inflammation?
So a lot of this regenerative treatment is injection technique. And so when we inject with the mechanical rotation of the needle itself, plus the solution which we inject, all of them like chemical and mechanical irritation of the area, we're creating inflammation.
So is this like ozone therapy and stuff like that?
Ozone, it's one of the area, one of the treatments, but from my training, from my experience, I think the fundamental treatment for regenerative medicine, if you will, in musculo-skeletal area, it's prolotherapy. Another name for prolotherapy is non-surgical reconstruction of tendons and ligaments. Why it's so important? Because tendons, especially ligaments, they're holding our skeleton together. And for example, for joint to be a functional unit, it's not just two bones. Two bones, we cannot use them. For these two bones to become a functional unit, we need supportive structures of the joint. We need ligaments, which connect bone to bone. We need tendons, which attach muscle to the bone. We need joint capsule, which like hugs both bones together. It's like a cuff, which connect again, the secure both bones together. And all the structures has to we call it supportive structures of the joint because they do support the joint. They make it these two bones like a functional unit. Other function of the supportive structures is to let our brain know in what position we are in a space. That's why these structures have a lot of nerve ending. And when these structures become overstretched, injured, partially torn or degenerated due to age and overuse and abuse, um, these nerves in these structures become very irritated, which create a lot of pain. And a lot of time, the pain generated not just the joint itself, not the space in between these bones, but pain most of the time comes from the supportive structures of the joint. And the prolotherapy, again, I'm coming back to prolotherapy. The prolotherapy, again, it's non-surgical reconstruction of tendons and ligaments. Why it's important? As soon as we kind of like tighten up, help our body to strengthen the supportive structure of the joint will regain stability and will not kind of like compromise itself, because when joint is steady, the bones will move against each other in the proper trajectory. But when support is loose, joint will go like in the wrong direction and will kind of wear tear itself more. So as soon as we will regain the supportive structure of the joint, pain will go away from these structures and joint will start to function in the proper trajectory, and it will help the regeneration joint in the whole as a unit.
That's amazing.
It is amazing. It is amazing. And I mean, the body responds to it. Again, if body has all necessary ingredients for the healing process practically inevitable. The speed of the healing process might be, of course, not might be, it is different depending on the person's age, but it's always there. My oldest patient for prolotherapy, she's 93,
Wow.
and the youngest one, 14. So this is the age range, the people who do respond to prolotherapy. And again, the prolotherapy is a foundation. And another thing is, philosophy of prolotherapy is a comprehensive treatment of entire region, not just the spot which bothers person the most. Imagine that we have an orchestra and we have like musicians, and all of them kind of playing okay, but two of them horrible. If you will replace those horrible musicians, and we will not get the best music in the world. We have to retrain the entire orchestra that all musicians will be at their best. The same happening with the with the joint or whatever specific part of the body. So all components, all muscle attachment, tendons, ligaments, and nerves, in blood supply and everything, and the nutrients has to be in the best possible level. Then this unit will function properly. That's why when we utilize prolotherapy technique, we have to treat the entire region, not just the particular spot which bothers the most, because most of the time, it's not just a very focal thing. It's probably this particular spot took the bullet and was suffering the most because the whole unit doesn't function. So we have to strengthen the entire region. Classical prolotherapy done with dextrose. It's a sugar solution. Now everybody afraid of word sugar, but it's a good one. Our body responds very favorably to that, particular to dextrose injection. But with today's technology, modern technology, and advances in regenerative medicine, we can do the same prolotherapy at the higher level, and we provide more intense stimulation, more intense trigger for self-regenerative process, and we can use patient's plasma.
Wow.
We call it PRP, platelets-rich plasma. Today, a lot of doctors using PRP, but technique how PRP applied make again the big difference in outcome. When PRP injected, like in the most compromised area, like 1, 2, maximum 3 shot, that's good. And a lot of people do feel better, but a lot of time it's not good enough because if area is big, and most of the time when we have joint issue or back issue, it's usually like rather big territory which should be addressed. So the treatment should be comprehensive, not just like very pinpoint. And when PRP used, applied with the prolotherapy technique, which is comprehensive treatment, in this case, we have a much better chance to get a better outcome.
That is really intense. That's amazing that why isn't this more well known? I mean, is it fairly well used within the field of
Well, the field is definitely growing and it's like people become more and more aware about it, and a lot of people taking matter in their own hands about their healing. Um, it's difficult to it's difficult to say why it's okay. Coming back to prolotherapy, prolotherapy it's not actually a new technique. The prolotherapy was developed in US. It's our method. And the first book about prolotherapy, if um, I'm not mistaken, was written in 1930s, 1940s. So the technique is almost 100 years old, which is known today. But actually, roots of this technique comes back to the ancient Rome. The
wow.
idea of the creating inflammation, which will trigger self-regenerative process, was utilized in the ancient Rome in the gladiators to help to heal them quicker.
Wow. So how does
Um,
this differ from ozone therapy?
Ozone therapy, it's I love ozone therapy, and ozone it's a gas. It's a mixture of oxygen, medical oxygen, and ozone. And ozone again, it's an active form of oxygen. The oxygen itself is O2, and ozone is O3. And the third atom in molecule very loosely attached. When we inject ozone to the body, um, this like third atom become very easily detached and engage with the other tissue and improve oxygen supplementation to the tissue, stimulate immune system. And when tissue start to breathe due to improve oxygenation, improve oxygen supply, tissue start to function better, start to regenerate better. And I love to add ozone to prolotherapy. I love to add ozone to PRP prolo. When I do PRP, I call it PRP prolo, not just PRP. Because again, I do not do just one or two, three shots. I use my prolotherapy technique with injecting patient plasma. And on top of that, I love to add ozone, which really facilitate the healing process. Sometimes when, for some reason, we cannot, the prolotherapy or PRP not recommended, or patient choose not to have it and would like to prefer like more gentle technique, we can combine injection of ozone with the homeopathic solutions.
What
Usually,
homeopathic solutions are you talking about?
the injectable, we can use Tromil, we can use, I mean, the same, we can use also dextrose, but the different concentration. We can use B12. I mean, it's not homeopathic. The Tromil considered the injectable homeopathy in other formulas. And we also have to use some anesthetic a little bit because ozone by itself, it's very painful injection. But when we use some lidocaine or procaine, some different type of anesthetic, so injection practically painless. And using the ozone, it's a very good addition to any kind of regenerative treatments. I love it a lot, and it really helps facilitate the healing process. Plus, ozone, all the time when we do any kind of injection, I mean, theoretically, there's a chance of infection, and it has nothing to do with the regenerative treatment, but the fact that you will go with the needle through the skin, there is a chance of infection. But when we inject ozone on top of whatever injection we would do, on top of that, we're practically bringing this chance to zero, because ozone on top of everything will kill any infection like viruses, bacteria, fungus, whatever. And it's another big plus to add ozone to the treatment.
So that sounds all so amazing. I mean, so you've also talked about the use of ultrasound when we talked previously.
I utilize ultrasound as a diagnostic tool in the office. So when patient come to me with the whatever shoulder, knee, whatever problem, I can do ultrasound scanning like in the office and get the better idea of what is going on with the patient instead of sending to the MRI, X-ray, or whatever, losing time and sending patient back and forth. So we can establish diagnosis right away. This is one way of using ultrasound, diagnostic ultrasound. And another way, I do a lot of my procedures ultrasound guided. So I see exactly where I have to place my needle. And instead of kind of like knowing the anatomy, I always use my palpation skills. But on top of that, when I can see exactly where to place my needle, so injection goes much easier, much smoother. With much less discomfort, and ultrasound is a great technique. It does not have any radiation because, for example, fluoroscopic guided injections, it's an excellent tool, but fluoroscopy, it's a way of X-ray. It's a form of X-ray, and there is some dose of radiation. We have to remember that ultrasound doesn't have it in sound, and ultrasound help us not only to deliver solution exactly to the point where it has to be, which really increase the efficacy of the procedure. And probably most importantly, we can see where not to inject, where not to go. So it makes procedure much, much safer. So with ultrasound guidance, again, treatment is with less discomfort, more effective, and much safer.